So Mark was my big brother. We were only 18 months apart in age, so we were very, very close. We lived in each other's pockets, really. He was very much a family man, married with a 3-year-old daughter. Everything to look forward to. Worked hard, loved life, put a smile on people's faces. Mark had been out for a meal on the weekend before he was seriously unwell, and he's had a stomach bug for a couple of days. So he accessed healthcare and was told he probably had gastric flu. To go home, drink some water, keep his fluids up, he'd be fine in a couple of days. But Mark didn't get better within a couple of days, so he accessed healthcare again and was told pretty much the same thing, And for the third time, he accessed healthcare on the Thursday, at which point he had chronic stomach pains. And it was at that point he was told to go to A&E. I was actually there on the day. As soon as I saw Mark, I knew he wasn't quite right. He was a bit confused, a bit distracted. He was very, very different to how he'd been the day before. He was asked a very specific question about his weight. He was asked, "Are you normally this size?" To which he replied, "I'm doing a marathon, I've done a triathlon," which isn't the answer to that question. So for me, it was just a strange thing to witness, not realising at the time the significance of Mark's confusion. It wasn't picked up on by the medical staff there, but of course they don't know him like I knew him. And I didn't know the power I had at that time had I known the right way to act. So Mark returned to the ward about 5 p.m. and I met him there with his wife. I went outside to make a phone call to my parents at that point, by which time, once I returned, he'd had a cardiac arrest. So he'd walked in at 12 that day, and by 5:15 the very same day, he'd had a cardiac arrest upstairs while I was outside on the phone to my mother telling her for the very first time that Mark was in hospital with a bad stomach. He went into intensive care by about 7:15 and in an induced coma. He wasn't strong enough, his heart wasn't strong enough for the dialysis machine, so we were called back to the hospital at midnight the same day of him going in. And despite the best of care in intensive care, having walked in at midday on the Thursday, he was dead by the Saturday lunchtime of multiple organ failure, having gone into septic shock. It was really, really difficult because, we were all there. I mean, Manuela was there, his daughter was there, 3 years old. He's taken her to nursery that morning, and that night he's in an induced coma, and she never sees her father alive again at 3.5 years old. So it's absolutely crucial that both the members of the community and members of healthcare are aware of the signs and symptoms of sepsis, because it's relatively easy to treat if diagnosed quickly. The key thing here, much like stroke, is time. When I was with him in A&E, I could have acted differently. If I'd have known at the time the confusion was a sign of infection, I would have raised that with the medical staff. If the medical staff had trained themselves, then you can start thinking about infection. Could this be sepsis? He was very different yesterday. Can you explain what's going on here? There's certainly progress in knowledge of the word, but I don't think people have a relationship with it or understanding in the same way they might do with stroke or meningitis.
So sepsis is essentially an overreaction of the body's own immune system to the presence of an infection. Now, infection is common, and we have sort of pre-programmed ways to respond to infection. The big thing with sepsis is essentially a completely out-of-kilter response to infection. Instead of being localized, they become more generalized throughout the whole body. We know that it's that sort of problem which then leads to the blood flow to the various vital organs becoming inadequate for the normal function. And so they start to show signs of struggling and then actually going into failure. It can happen to anybody at any age, particularly if we think about the extremes of age, so the very, very young and the elderly, people with heart problems, chest problems, kidney problems. And of course, there are a lot of other conditions that people receive treatment for which can affect the functioning of their own immune system. We've been aware for some time, certainly going back, more than 10 years, that public knowledge of sepsis was very vague, patchy, poorly understood. Over the last 10 years, we have managed to increase that level of knowledge. Substantially, people are aware of the term sepsis through lots of well-publicised stories through the media. The symptoms can be quite varied and wide and are not particularly specific. However, there are certain things we do look out for, which is obviously one of the most important things. You have to have evidence of an infection to have sepsis. But we mainly sort of think about things like people who are slurring their speech, for instance, because they're not getting enough oxygen into the brain, almost acting as if they're drunk or maybe they're having a stroke. We look for things like extreme shivering or muscle pain, something you might have experienced if you've got a really bad dose of, good old-fashioned influenza, as it were. If you're not passing any urine, that's a concerning sign. We talk about things like skin mottling, again, suggesting blood flow to the skin is less than it would normally be. We look for things like feeling really, really short of breath. And again, there's one thing, you might think, oh, I've just got a bit of a cold or a bit of a mild chest infection. Actually, it could be something far more serious.